Hello friends, welcome back to my channel. Hope all are doing good. This video is my 20th notebook of microbiology subject for Neet PG exam. Burkholderia cepacia is resistant to cefotetan. Other drugs resistant to cefotetan are aminoglycosides, polymyxin, carboxypenicillin, first and second generation cephalosporins. Drugs effective against Burkholderia cepacia include ceftazidime, timoxilin, trimethoprim sulfamethoxazole, meropenem. Nude mice is not resistant to xenograft due to absence of T cell. Nude mice lacks thymus. There is prevention of functioning T cells. There is prevention of rejection of allograft and xenograft. Next is Pseudomonas aeruginosa. Pseudomonas aeruginosa causes chondroid fish poisoning within 15 to 90 minutes of ingestion. There is decarboxylation of amino acid L-histidine to form histamine. Toxin is heat stable. Without treatment itself, symptoms reduces by 8 to 12 hours. Predominant pathogen to infect renal transplant recipient is cytomegalovirus. Cytomegalovirus infection occurs 1 to 4 months following transplantation. BK and JC viruses are the most common organism to infect kidney after any solid organ transplant. Antiviral prophylaxis is ganciclovir or valganciclovir to prevent cytomegalovirus disease. HBsAg is Australia antigen. Bacterial transduction occurs by bacteriophage. Bacterial transduction is acquiring bacterial DNA from phage bacterial DNA from previous host bacteria. Transformation is uptake of genetic material from environment. Conjugation is direct transfer of DNA from one bacterial cell to other through sex pilus or bridge. Sabin-Feldman dye test is the diagnosis of toxoplasmosis. Anti-toxoplasma antibodies in patient serum prevents staining of trophozoite by alkaline methylene blue dye. If anti-toxoplasma antibodies in patient serum is positive, trophozoites will not be stained. If it is negative, trophozoites will be blue in color. Detects only IgG antibodies. Rhizobus is an angio-invasive fungus which leads to septicemia as well as thrombosis. Rhizobus is the most common fungus which causes orbital cellulitis in patients with diabetic ketoacidosis. Rhizosis is mainly caused by diabetic patients, that means mainly immunocompromised patients. Adult form of Echinococcus is dog. It is the definitive host. Man is the accidental intermediate host. Man is the dead end host. Sheep, goat and swine are the intermediate host. Echinococcus causes hydatid cyst. Leishman-Donovan body causes Kala azar. Here the vector is sandfly. There will be amastigotes with double dot appearance. Nucleus and small rod-like kinetoplast is present inside the macrophage. Next is lactobacilli. Lactobacilli can grow in acidic pH. Lactobacilli is gram-positive, facultative anaerobe, non-motile, non-spore forming. Lactobacilli derives lactic acid from glucose. It is found in vagina as a part of normal microbiota. Acute graft rejection as well as chronic graft rejection is due to type 4 hypersensitivity reaction. TB test is done only on whole blood sample by interferon gamma release assay. Diagnosis of latent TB in patients with HIV who have negative is Mantoux test. Interferon gamma release assay includes quantiferon TB, which is the gold standard investigation. It mainly measures the amount of interferon gamma. The other investigative method of interferon gamma release assay is T-spot TB. It measures the number of effector T cells. Gene expert is the molecular method of testing. TrueNat TB test mainly assess the rifampicin resistance. Multiple abscess discharging sinuses, sulfur granules in pus. These all are features of actinomyces. Oral cervicofacial angle of jaw, there will be a mass lesion in actinomyces. Cutaneous larva migrans, most common cause is Ankylostoma brasiliense. Cutaneous larva migrans, clinical feature is like there will be a ground itch creeping eruption by nematode larva which infects the skin by penetration. Hyperacute rejection of renal transplant is by type 2 hypersensitivity reaction mediated by preformed antibodies. Mycoplasma lacks cell wall. Mycoplasma prevents resistance to beta-lactam antibiotics. H. pylori produce urease. Urease producing organisms are Protease, Urea plasma urea lyticum, Nocardia, Cryptococcus, Corynebacterium urea lyticum, H. pylori. Two methods of pasteurization include Holder method as well as flash process. In Holder method, the temperature is 63 degrees Celsius for 30 minutes. Flash process, we use 72 degrees Celsius for 15 to 20 seconds. Holder method and flash process, these both are followed by cooling quickly to 13 degrees Celsius or lower. All non-sporing pathogens are killed except Coxella burnetii which survive in Holder method. A patient from Delhi has fever, arthralgia, extensive petechial rash for 3 days. Hemoglobin is 9 gram per deciliter. That means hemoglobin is reduced. WBC is 9000 cells per millimeter cube. Platelet is 20,000 cells per millimeter cube. BT is prolonged. CT is normal. Diagnosis is dengue. Dengue is caused by dengue serotypes 1 to 4. It belongs to Flaviviridae family. Contact is through person to person through the bite of Aedes aegypti mosquito. Classical dengue fever includes high fever, headache, retroorbital pain, myalgia, arthralgia, petechial rash, leukopenia, thrombocytopenia, macular-papular rash, white islands in Red Sea which is due to erythema with petechiae, break-bone fever, 7-day fever, dengue hemorrhagic fever, dengue shock syndrome. All these features we should remember in dengue case. Trichomonas vaginalis, there will be twitching motility in wet saline mount, strawberry cervix, chicken-like epithelium due to intercellular edema. Gold standard investigation is culture on cysteine peptone liver maltose, that is CPLM medium or plastic envelope medium. Treatment is by metronidazole 2 gram orally as single dose. Next is scrub typhus. It is caused by trombiculate mites. Typhoid, we can see rose spots. Darting motility is seen in Vibrio. Swarming motility is seen in Clostridium septicum as well as Bacillus cereus. Tumbling motility is seen in Listeria monocytogens. Differential motility is seen in Listeria monocytogens. Corkscrew motility is seen in Treponema pallidum. Falling leaf motility is seen in Giardia. Next case is a patient from West Rajasthan had a ulcer surrounded by erythema on right leg. Microscopic examination, edge of ulcer, there was organism with dark staining nuclei and kinetoplast. Leishmania tropicae, which causes cutaneous leishmaniasis, is the diagnosis. There will be bite of infected female phlebotomous sandfly, that is a nocturnal pest, which inoculates flagellated promastigotes into skin of host. In India, Bihar, West Bengal, Jharkhand and UP are the main area causing leishmaniasis. Promastigote is present extracellularly in sandfly vector. Amastigote is present intracellularly in the reticuloendothelial cells of host. Amastigote form contains kinetoplast which includes parabasal body as well as blepharoplast. Amastigote form is present intracellularly inside macrophages, monocytes as well as reticuloendothelial cells. Amastigote form is present in Leishman-Donovan body. Flagellum is absent here. Diagnosis of Kala-Azar include amastigotes within macrophages in blood, bone marrow and lymph node aspirate. It is the gold standard investigation for diagnosis. Promastigote form is kinetoplast, which is an infective form of Leishmania donovani for humans. Single flagellum will be present there. Tests to detect leishmaniasis include rapid diagnostic test, which includes RK39 Kala Azar dipstick test strip. LD bodies in Buffy coat smear is the confirmatory test for leishmaniasis. Other tests include aldehyde test for Napier, rapid dipstick test, ELISA, direct agglutination test, indirect fluorescent antibody test, Leishmania test or Montenegro test, which shows induration of 5 mm or more, which is positive for leishmaniasis. Drugs given for visceral leishmaniasis include sodium stibogluconate, miltefosine, as well as amphotericin B. In Bihar, there is resistance to antimony, so amphotericin B deoxycholate or miltefosine is preferred. Babesiosis is a tick-borne disease. Next case is a child came with fever and rash. On urine examination, there was cells with owl eye appearance. Diagnosis is cytomegalovirus. It is the largest virus of herpes family of virus. Laboratory investigation for cytomegalovirus infection is virus from urine, saliva or other fluids into human fibroblast cells should be taken. Antibody demonstration includes ELISA. Diagnosis is by ELISA for primary infections. Cytomegalic pneumocyte containing intranuclear basophilic inclusion surrounded by clear halo, which is known as owl's eye appearance. It is seen in cytomegalovirus infection. Next is features of Epstein-Barr virus. There will be glandular fever associated with infectious mononucleosis. Hodgkin's lymphoma will be present, non-Hodgkin's lymphoma, Burkitt's lymphoma, nasopharyngeal carcinoma. All these are associated with Epstein-Barr virus infection. The rash and vesicles of chickenpox are centripetal. There will be dew drops on rose petal appearance. Measles are retroauricular origin. Erythema infectiosum shows slapped cheek appearance. Next is clonochiasis, that means Chinese liver fluke or Clonorchis sinensis infection is associated with increased risk of cholangiocarcinoma. Clonorchis sinensis is endemic in South China, Japan, Korea and Taiwan. Consuming raw fresh water fish or shellfish can cause Clonorchis sinensis infection, that is clonorchiasis or Chinese liver fluke. Humans are infected by eating raw or undercooked fish containing encysted larvae, that is metacercaria. First intermediate host is snail. Second intermediate host is freshwater fish. Liver imaging shows dilated biliary tract. Common bile duct and gallbladder will be affected in humans. Next case is a patient came with complaints of persistent cough, weight loss, history of contact with multiple sexual partners. Patient is diagnosed with HIV 6 months back, poorly adherent to tablets. Fungal culture of sputum is negative. On Gomori methamine silver staining, it was showing as darkly stained crescent-shaped cyst. Cyst wall was black with Gomori's methenamine silver stain, which showed crushed ping pong balls of Pneumocystis jirovacea. So this is caused by Pneumocystis jirovacea. Diagnosis is pneumonia, which is caused by Pneumocystis jirovacea. It is an opportunistic infection. CD4 count falls below 200 cells per milliliter. Lab investigation include increased LDH, perihilar and diffuse bilateral interstitial infiltrates are present. CT includes ground glass opacities. By Giemsa stain, toluidine blue, methenamine silver as well as calcofluor white, we can see trophozoites. Treatment for Pneumocystis jirovacea infection is trimethoprim sulfamethoxazole combination, that is clotrimoxazole, for 21 days as prophylaxis we should give. If a patient has allergic with clotrimoxazole, we should give IV pentamidine. Glucocorticoids are also given to reduce pulmonary inflammation. A sewage worker. He had abdominal pain, jaundice, conjunctival suffusion. Blood in urine was present for past 5 days. Diagnosis is leptospirosis, which is also known as Wales disease. It is a zoonotic disease. It is caused by Leptospira interrogans. It causes aseptic meningitis, hepatorenal damage. Water contaminated with urine of carrier animals enter body through cuts or abrasions on skin. Splash contamination of eyes is also present here. Reservoir for leptospirosis is rat, dog as well as horse. Lab investigation includes dark field microscopy or immunofluorescence. Investigation of choice is microscopic agglutination test. Culture is by semi-synthetic media which includes EMJH media or Stewart's media. Treatment is by IV penicillin, IV ceftriaxone. Doxycycline is given 200 mg orally once a week. Next is about the mediums. Mannitol salt agar and Ludlam's media is used in Staphylococcus aureus. Crystal violet blood agar CVBA is used in Streptococcus pyogenes. Thier Martin medium is used in Neisseria meningitidis. Potassium tellurite agar as well as McLeod medium is used in Corynebacterium. PLET medium is used in Bacillus anthrax. MYPA medium is used in Bacillus cereus. CCFA medium is used in Clostridium. Wilson and Blair bismuth sulfite medium is used in Salmonella. Castaneda medium is used in Brucella. TCBS medium is used in Vibrio. Levinthal medium is used in Haemophilus influenza. BCYE medium is used in Legionella pneumophilia. BSK medium is used for Bacillus burgdorferi. Antigen enzyme immunoassays and PCR detects virus in stool. Rapid antigen detection in stool sample diagnose rotavirus diarrhea. Next case is a patient presented with fever, chills, rapid test positive, that means for specific antigen HRP2. It is only by asexual forms of Plasmodium falciparum. Rapid test positive is the first diagnostic test done. This is the case of malaria, which is caused by Plasmodium falciparum. It is due to the bite of Anopheles mosquito. Other diagnostic tests include dual antigen test, which contains LTH of trophozoite and gametocyte as well as HRP2. Next is a case of meningitis. A child with high fever, multiple seizures, headache, neck rigidity. CSF showed decreased glucose, increased protein. There were many polymorphs, pleomorphic gram-negative bacilli. The diagnosis is meningitis, which is caused by Haemophilus influenza, which exhibits satellitism around Staph aureus colonies. Haemophilus influenza is non-motile as well as non-sporing. Sputum examination showed Haemophilus influenza, which was Coccobacillus. CSF finding was Haemoinfluenza, which showed filamentous bacillus. Blood examination, there was growth factor 5, which was by NAD, and growth factor 10 with the help of hemin. Haemophilus influenza is a capsular polysaccharide which has polyribosyl ribitol phosphate antigen, that is PRP antigen. Haemophilus meningitis treatment is cefotaxime or ceftazidime. Live attenuated vaccines include mumps, BCG, plague, influenza, typhoid, yellow fever, rubella, rotavirus, oral poliovirus, that is Sabin, measles, Japanese encephalitis, varicella. Killed whole organism vaccines include typhoid vaccine, rabies, influenza, polio vaccine, that is IPV, as well as Salk vaccine, hepatitis A, cholera, encephalitis. Recombinant vaccine is used for hepatitis B, Lyme's disease, human papillomavirus, as well as cholera toxin B. Next case is a patient presented with high fever, altered sensorium, headache, neck rigidity, seizures. Diagnosis is HSV encephalitis. CSF PCR for viral DNA is the investigation of choice. T2 weighted MRI brain shows hyperintensity in temporal lobe. Bilateral involvement of temporal lobe is most common in HSV encephalitis. Treatment of HSV encephalitis include intracranial pressure monitoring, fluid restriction, avoidance of hypotonic IV fluids, anticonvulsants for seizures, IV acyclovir. Next case is a patient presented with fever. Filarial antigen test was positive. Patient had acute attacks of lymphangitis. Lymphadenitis was also present. Diagnosis is filariasis. Concentration techniques used is membrane filter concentration. Treatment is by detection of microfilaria in blood smear by microscopic examination. It is the microfilaria is detected at night time, that is nocturnal periodicity from 10 pm to 2 am. Treatment of filariasis include DEC. Triple drug combination includes ivermectin, DEC as well as albendazole. Next is genital herpes is caused by HSV1-2. There will be blisters, painful blisters, kissing ulcers. Soft chancre or chancroid is caused by H2 gray. There is school of fish appearance, railroad track appearance. These blisters are painful. There is non-indurated unilateral inguinal buboes in soft chancre or chancroid. Next case is a patient came with history of dysuria, urethral discharge after unprotected sex. Gram staining showed a gram-negative intracellular diplococci. Patient had purulent discharge. Diagnosis is Neisseria, which is caused by Neisseria gonorrhea. Culture medium include Thayer-Martin agar, chocolate agar or Muller-Hinton agar. Treatment is ceftriaxone, which is given as single therapy. Fitzhugh-Curtis syndrome, Stewart's medium, all these should be remembered in Neisseria. First line drug for Neisseria case is oral doxycycline 100 mg 101 into 7 days. Partner should be also treated. Syphilitic chancre is also known as heart chancre caused by Treponema pallidum. There will be small indurated ulcer which is like a button. There will be painless lymph nodes. On microscopy we can see spirochetes under dark ground illumination. Granuloma inguinale or donovanosis is caused by Klebsiella granulomatis, which is also known as Calamantobacterium granulomatis. There will be beefy red genital ulcers, bleeds on touch. There will be painless ulcers, lymph nodes will be absent, pseudobubos are present. On microscopic evaluation, we can see Donovan bodies with closed safety pin appearance. All these features are of donovanosis. Next is lymphogranuloma venereum. It is caused by Chlamydia trachomatis. There will be single shallow ulcer. It heals rapidly. During secondary stage, there will be tender inguinal buboes. Groove sign is present. Lymph node above and below inguinal ligaments are enlarged, which forms a groove. So it is known as groove sign. These all are features of lymphogranuloma venereum. Next is a patient who is a photographer from Africa had abdominal pain, hepatomegaly, hemorrhagic manifestations. He died, and after his death, when autopsy was taken, it showed intranuclear torus bodies in liver. Diagnosis is yellow fever, which is caused by flavivirus. Vaccine here we should take is 17D vaccine given subcutaneously. 17D vaccine is a live attenuated vaccine. Yellow fever is caused due to the bite of Aedes aegypti as well as Aedes africanus. Contraindication of yellow fever vaccine, that is 17D live attenuated vaccine, is egg allergy, pregnancy, infants less than 9 months of age. Varicella vaccine include OKA strain, JE vaccine include Nakayama strain, Beijing P3 strain, SA1414-2 strain. Nakayama vaccine is taken for Japanese encephalitis. Japanese encephalitis, the vector is Culex tritaniorhynchus. Gerald Lynn strain is for mumps virus. Gerald Lynn strain is a live attenuated vaccine. Here in mumps virus infection, that means in mumps we can see parotid swelling, tenderness as well as fever. Weigels vaccine is taken for epidemic typhus as well as Rickettsia provoziki. Epidemic typhus is seen in patients in Kashmir. Vector is human body louse, which is also known as Pediculus humanus corporis. Rash will be present in the trunk and limbs, sparing face, palms, and soles. Rubella vaccine is RA27 by 3. A patient who is a militant had rashes all over the body, sparing palms and soles. He is febrile, lice were noted. Epidemic typhus or louse-borne typhus, which caused Rickettsia provoziki, is the diagnosis. Incubation period is 5 to 15 days. Infection is by scratching or inhalation of aerosols of dried louse feces. Rickettsia typhi is caused by murine, that is flea-borne or endemic typhus. Rickettsia conori is a Mediterranean spotted fever which is caused by ticks. There will be a scar which is known as tachenoire. Microfilaria has sheathed tail with two nuclei at the tail tip. It is caused by Brugia malai. Nocturnal periodicity is noted. Female filarial worms belongs to phylum Nematoda, is also known as microfilaria. Occult filariasis causes Meyers-Covenard syndrome, hypersensitivity reaction to microfilarial antigens. Tropical pulmonary eosinophilia, there will be increased IgE levels. Treatment is DEC. Head lice causes Pediculus capitis. Body lice causes Pediculus corporis. Crab louse causes Thyrus pubis, that is pubic louse. Vectors for this pediculosis is epidemic typhus, relapsing fever, trench fever. Treatment is by malathion, which is given as lotion or powder. Loa loa causes subcutaneous filariasis. It causes calabar or fugitive swellings. It has diurnal periodicity. Nuclei is present in a row up to tail tip of sheathed microfilaria. Next is Onchocerca volvulus. It is also known as blinding filaria. It is non-periodic. Onchocerca volvulus causes onchocerciasis. Onchocerca volvulus is unsheathed. Onchocerca volvulus causes subcutaneous nodules which is known as onchocercoma. There will be dermatitis, blindness as well as photophobia. Indications of ivermectin include scabies, head lice, strongyloidiasis, onchocerciasis, chemoprophylaxis of filariasis. Next is Aspergillus colonies are velvety powder. Aspergillus fumigatus are dark green colonies. Aspergillus niger is black in color. On microscopic examination, dichotomous branching at acute angles after staining is seen in aspergillosis. Invasive aspergillosis is seen in immunocompromised patients. Next is cervical lymphadenopathy is retrospective. Fungal culture showed velvety growth with red diffusible pigment on underside. This is caused by Talaromyces marnefi, which is also known as Penicillium marnefi. The diagnostic condition is known as talaromycosis or penicilliosis. This Talaromyces marnefi or Penicillium marnefi, it is a dimorphic fungi. It is associated with AIDS. There will be a red pigment known as agar. On histopathological examination, there will be yeast-like organism with central septation. Treatment for penicilliosis or talaromycosis is itraconazole as well as amphotericin B. Yeast is Cryptococcus saccharomyces. Yeast-like is Candida as well as Malassezia furfur. Blastomyces is thermally dimorphic fungi. It causes blastomycosis. On microscopic examination, there is broad-based budding yeast cells in blastomyces. Aseptate hyphae is seen in Mucor as well as Rhizopus. Septate hyphae is seen in Penicillium, Aspergillus as well as dermatophytes. Dimorphic fungi is caused by Histoplasma capsulatum, Blastomyces dermatitidis, Sporothrix schenki. Next is a patient presented with itching on the axilla. On microscopic examination, skin scrapings showed a red pigment fungus which was non-diffusible pigment. There is a pencil-shaped macroconidia. This is caused by Trichophyton rubrum. Trichophyton rubrum causes Tinea corporis. Trichophyton rubrum is a dermatophytic fungi which affects the skin, hair, and nails. Tinea violaceus is a very slowly growing, waxy, purple or violet pigmented lesion which has a distorted hyphae on microscopic examination. Tinea tonsurens shows creamy or yellowish colonies with central furrows. On wood slab examination, Wood's filter showed barium silicate 9% nickel oxide. Wavelength is 320 to 450 nanometer. Peak wavelength is 365 nanometer. On wood slab examination, erythrasma shows coral pink color, pityriasis versicolor shows faint yellow, pseudomonas show green color, vitiligo shows ivory or milky white. Bird seed agar as well as brain heart infusion agar, these both are non-specific media used in fungal culture. Next is a case. A female presented with thick white vaginal secretions. Diagnosis is candidiasis. Culture is done by CHROM agar. Candida albicans shows green color. Candida glabrata shows purple color. Candida parapsilosis shows pinkish hue color. On gram staining, it shows gram-positive budding cells. Mycelial forms show colonization. Treatment of candidiasis include topical nystatin or oral ketoconazole. Next case is 12-year-old patient with right upper quadrant pain, calf pain, conjunctival suffusion, icterus, fever, tender hepatomegaly. Diagnosis is leptospirosis. Leptospirosis is a zoonotic condition. Treatment of leptospirosis is oral doxycycline, ampicillin, amoxicillin. Wheel syndrome triad is hemorrhage, jaundice, acute kidney injury. Investigation of leptospira is by dark field microscope. Diagnosis is by microscopic agglutination test from the cuts or breaks of skin and mucous membrane. Acute leptospiremic phase is checked in the blood and resolving immune phase is checked in urine. Saddleback fever and migratory arthralgia are important features of chikungunya. Next is a case. A newly joined teacher has rice water stool as well as vomiting. The diagnosis is cholera which is caused by Vibrio. Vibrio cholera has polar flagellum. There is GM1 ganglioside receptor here. Complications of cholera include pulmonary edema as well as arrhythmia. Darting motility is present. Fluid resuscitation is done by rice-based ORS. Treatment of Vibrio cholerae is erythromycin as well as azithromycin. Next is about the precipitation test. Elect gel precipitation test is done for Corynebacterium diphtheria. Paul Bunnell test is done for infectious mononucleosis. Weidel test is done for typhoid. Weil-Felix reaction is done for typhus fever. Paul Bunnell reaction is done for infectious mononucleosis. Neutralization test includes Schick test, ASO test, Nagler's reaction. Schick test is done for diphtheria. Nagler's reaction is done for Clostridium perfringens. Glutamate dehydrogenase and toxin assay are the best for the detection for Clostridium difficile. Clostridium difficile causes pseudomembranous colitis. Investigation of choice is NAT methods which include PCR or by culture. Treatment of pseudomembranous colitis include oral fidaxomicin or vancomycin. Next case is a diabetic truck driver has cough, breathlessness, pneumonia is confirmed. On histopathological evaluation, there was dichotomous branching. Diagnosis is Aspergillus fumigatus. Aspergillus is seen in immunocompromised patients. Drug of choice is voriconazole. Allergic bronchopulmonary aspergillosis causes central bronchiectasis. Complications include aspergilloma as well as otomycosis. Diagnosis include galactomannan culture isolation. On microscopic examination, lactophenol cotton blue medium is used which shows septate hyphae as well as conidiophores. Next is rhizopus and mucor. These both causes mucormycosis. It shows non-septate broad hyphae in H and E stain. Candida is a gram-positive cell which shows mycelial forms that suggest colonization. Next is a case. A woman who had recurrent diarrhea was on broad spectrum antibiotic. Patient was diagnosed with detection of toxin or organism in stool sample. The organism was Clostridium difficile. Clostridium difficile causes pseudomembranous colitis. Patient was on cephalosporins, ampicillin, clindamycin. Risk factors for Clostridium difficile infection is poor hand hygiene, old age, gastrointestinal surgery. Treatment of Clostridium difficile infection, that is pseudomembranous colitis, is vancomycin or oral fidaxomicin is used. Pseudomembrane consists of leukocytes, fibrin as well as cellular debris. Next is tsetse fly. It belongs to Glossina species. It causes sleeping sickness or African trypanosomiasis. It is mainly caused by Trypanosoma brucei. Blood routine, we can see anemia, leukocytosis as well as thrombocytopenia. Next is triatomine bug, which is also known as reduvit bug or kissing bug. It causes Chagas disease or American trypanosomiasis. It is caused by Trypanosoma cruzi. The disease name is Chagas disease or American trypanosomiasis, which causes chagoma. There will be cardiac myopathy, megaesophagus as well as megacolon as complication. Next is Plasmodium vivax. There will be Schaffner's dots present. In peripheral blood, there will be trophozoites, schizones as well as gametocytes. In Plasmodium ovale, there will be fimbriated Schaffner's dots as well as James dots. In peripheral blood, there will be trophozoites, schizones as well as gametocytes. In Plasmodium falciparum, there will be ring formation, axole formation and banana-shaped gametocytes. In Plasmodium malarium, there will be band forms. On peripheral smear of blood, there will be Zeeman's stippling. Infectious mononucleosis incubation period is 4 to 5 weeks. Next case is a patient on steroids had chronic urticaria. Nocturnal cough was present for several weeks. On hemogram, there was elevated eosinophils. BAL was done, and on bronchoscopy, there was presence of larva. Diagnosis is strongyloids stercoralis infection. This strongyloids is a ovoviviparous. Life cycle includes filariform larvae. Through autoinfection, it is converted to rhabdatiform larva. Laboratory investigation includes eosinophilia. There will be increased IgE level. On microscopic examination, on taking direct wet mount stool, we can see rhabditiform larva, which confirms the diagnosis. Stool culture and serological test should be taken. Treatment of strongyloids stercoralis infection includes ivermectin. Klebsiella, E. coli as well as Salmonella, all these are oxidase negative. These belongs to Enterobacteriaceae group. Oxidase is negative there. Oxidase positive organisms include Pseudomonas vibrio, Legionella, Helicobacter, Neisseria, Campylobacter, Brucella, Moraxella, Burkholderia. Next is a case. A patient had 50% of burns. Infection at burn site was present. Swab was taken and cultured. Strict aerobe was isolated. That test was positive. There was positive oxidase test. Organism here is Pseudomonas aeruginosa. It is a gram negative. Catalase positive, oxidase positive. Swabbing motility is seen here. Non-lactate fermenting bacteria with greenish yellow pigment known as pyoverdin or fluorescein. Blue-green pigment is known as pyocyanin. Other pigments are pyorubin as well as pyomelanin. Diagnosis of Pseudomonas aeruginosa is by oxidase reaction as well as arginine hydrolysis. Next is a case. 1 week after an unprotected sexual intercourse, 25-year-old male was having purulent urethral discharge. It is caused by Neisseria gonorrhea. Lymphogranuloma venereum causes non-gonococcal urethritis, that is chlamydia trachomatis. Next is incubation period for mumps, chickenpox and rubella is 14 to 21 days. Non-gonococcal urethritis is caused by chlamydia trachomatis, trichomonas vaginalis, ureaplasma urealyticum of non-gonococcal urethritis. Measles is caused by paramyxovirus, which is enveloped single-stranded RNA virus. Koplik spots are seen in measles. Pathognomic features of measles include Warthin-Finkeldy giant cells, which is multinucleated giant cells. There is fusion of infected cells. Diagnosis of measles is by IgM antibodies. Measles incubation period is 7 to 18 days. Measles vaccine is given subcutaneously at right upper arm as 2 doses, one at 9 months and the next dose is at 16 to 24 months. Treatment of measles include low serum retinol level as well as vitamin A therapy. Next case is in males having gonorrhea, chronic urethritis which forms stricture formation. Water can perineum should be remembered here. In female, it can cause sterility. Fitz-Hoof-Curtis syndrome can be seen. Lab diagnosis of gonorrhea is gram-negative intracellular diplococci within phagocytes. Stewart's transport medium is the culture medium here. Culture also include chocolate agar or Muller-Hinton agar. Thayer-Martin agar should also be remembered in gonorrhea. Treatment is by ceftriaxone 250 mg intramuscularly as single dose plus azithromycin 1 gram per oral or oral doxycycline 100 mg 101 into 7 days. Treatment of syphilis include 2.4 million units of benzathine penicillin injection, which is given as IM route. Next is painless indurated genital ulcer was presented by a truck driver. He had syphilitic chancre or hard chancre. It is caused by Treponema pallidum. Staining is done by Fontana stain as well as Livatadine stain. Dark field microscopy was done here. Next case is 20 friends attended a late night party. They ate pastry from outside. They had nausea, vomiting. This is mainly caused by Staphylococcus aureus because of the enterotoxin. Enterotoxin is preformed toxin. It is heat stable. Enterotoxin stimulates vagus nerve, vomiting center of brain. It is a type A toxin. Enterotoxin of Staph aureus causes food poisoning within 30 minutes to 6 hours after consumption of contaminated food. Alkaline peptone water. It is a medium for Vibrio cholerae. Vibrio cholerae presents as watery diarrhea. 3-year-old child with fever, loose stools, blood in the stool, that is dysentery. Here the patient had bacillary dysentery due to Shigella. Enrichment medium used is selenite F broth. Microfilaria, there will be no nuclei at the tail end of the sheath. Wuchereria bancrofti is a microfilaria. The test done here is DEC provocation test. Tinea capitis shows white powdery colonies which is isolated from hair specimen. Hair perforation test is positive. It is caused by Trichophyton mendegrophytes. Next is a patient had acute brucellosis. Serum sample was taken by standard agglutination test. It is a tube agglutination test which identifies IgM antibodies. If standard agglutination test is negative at first because of prozone phenomenon and later it shows serial dilations of serum sample as positive. Prozone phenomenon is failure of the visible precipitation reaction which is due to failure of lattice formation by presence of increased antibodies. Zone of equivalence means antigen and antibody are same quantity and it has maximum precipitation. In post-zone phenomenon, there will be increased antigen. Next is brucellosis or undulant fever. It is a zoonotic disease. Gram-negative capnophilic coccobacilli. Lab investigation of brucellosis include PCR, blood culture with Castaneda method, standard agglutination test, complement fixation test, Coombs antiglobulin test, ELISA. Treatment of brucellosis include intramuscular injection of streptomycin, oral dose of doxycycline. Prevention of brucellosis is by pasteurization of milk and milk products. Aedes aegypti spreads Zika virus. Symptoms last for 2 to 7 days. During pregnancy, there will be microcephaly as well as congenital Zika syndrome. Complications of Zika virus include Guillain-Barré syndrome, neuropathy as well as myelitis. Next is about Sporothrix schenki. It is a dimorphic fungus. It causes traumatic inoculation into skin. Next about immunoglobulins. IgG causes chronic infection. It is the only maternal Ig to cross placenta. IgG causes complement fixation. IgG causes precipitation reaction. There will be neutralization of toxins and virus by IgG. IgM is a pentamer. IgM causes recent infections, agglutination present, hemolysis present, complement fixation as well as opsonization is seen in IgM. IgA means secretory IgA or A dimer which causes mucosal immunity. IgD serve as recognition receptors for antigen. IgE causes type 1 hypersensitivity reaction. IgE is the only heat labile antibody. IgE is increased in helminthic infections. Next is 14-year-old male patient with history of vomiting within 3 hours of consumption of food at party. The infection is caused by Staph aureus. Enterotoxin is the preformed toxin. Enterotoxin is heat stable. Enterotoxin stimulates vagus nerve as well as vomiting center of brain. Streptococcus pyogenes causes superantigen to streptococcal pyrogenic exotoxin. Superantigen contains T cells as well as the class 2 MHC is present outside peptide binding group and V beta region of TCR. A female patient from northeastern part of India complains of progressive swelling of upper limb. History of coronary artery disease was present. Percutaneous coronary intervention was done for it. Upper limb was more swollen proximally than distally. Diagnosis is filariasis. Test night blood for worms nocturnally periodic. That means in between 10 pm and 4 am this test is done. Next case is parasite is barrel in shape. Transmission is through soil. Egg is present in the stool. Patient had tenesmus, rectal prolapse, abdominal pain, abdominal distension, bloody mucus as well as diarrhea. All these are caused by Trichuris trichura, that is whipworm. Mucus plug is present at each pole. It contains unsegmented ovum. Plugs are colorless. They float in saturated salt solution. There is triple shell which is brown color. Barrel shaped eggs. Almost 200 adult worms causes heavy infections. Trichuris dysentery syndrome is present. These 200 adult worms are present in distal column and rectum. Treatment for Trichuris trichura include mebendazole or albendazole. HBS antigen card test kit is mainly based on immunochromatography. Next is 30-year-old female patient living in a tribal area presented with fever for last 3 days. Diagnosis is malaria. It is caused by Plasmodium falciparum. On peripheral smear examination, it showed ring forms or early trophozoites in RBC which resembled like stereo headphones. It showed binucleate, that means double chromatin appearance. 22-year-old male patient had high-grade fever with purpuric rash. CSF showed gram-negative diplococci. Diagnosis is Neisseria meningitidis. Fulminant meningococcemia is the severe form of Neisseria meningitidis. Patient will have high-grade fever, hemorrhagic rash, DIC, fulminant meningococcemia, circulatory collapse, which leads to Waterhouse-Friderichsen syndrome. Next is Japanese encephalitis virus. Human is the dead end host. Pig is the amplifier host. Herons are the reservoir host. Fimbria or pili helps in bacterial adhesion. Haemophilus ducreyi causes chancroid, that is soft chancre, does not cause urethritis. Next is 30-year-old HIV positive patient had history of chronic watery diarrhea. On histopathological evaluation, on duodenum there was Giardia lamblia, which is also known as Giardia duodenalis. The diagnosis is giardiasis. It is the only pathogenic protozoan present in duodenum and jejunum of humans. Infection is caused by water or food which is contaminated with cyst, feco-oral route, pear-shaped trophozoites with two equally sized nuclei, immunosuppressed patients, agamma-globulinemia, malnourished individuals, villus blunting as well as intraepithelial infiltrates. All these features are suggestive of giardiasis. Next is bioterrorism. Category A agent includes Bacillus anthracis, Clostridium botulinum, Yersinia pestis. Category B includes Coxella burnetii, Salmonella typhi, Chlamydia psittaci, Burkholderia mali, ricin toxin. Category C include Nipah virus, hantavirus. BCYE medium, which is known as buffered charcoal yeast extract agar medium, BCYE medium, that is used to culture Legionella pneumophilia. L-cysteine and antibiotic supplements include cefazolin, vancomycin, polymyxin B as well as charcoal, which is a detoxifying agent. Bacillus cereus is cultured by PEMBA. Campylobacter culture media is Scirrhus medium, Campi BAP or Bacillus agar. Drug of choice for invasive pulmonary aspergillosis is voriconazole. Sorbitol McConkie agar is used to differentiate E. coli from E. coli O157:H7. A 5-year-old patient had low-grade fever and inspiratory stridor for 5 days. Patient had barking cough. Diagnosis is laryngotracheobronchitis, which is caused by parainfluenza virus. On X-ray, it was showing steeple sign due to subglottic narrowing. Age group of this laryngotracheobronchitis is 6 months to 6 years of age. Treatment for laryngotracheobronchitis is racemic epinephrine nebulization. Dexamethasone is least invasive. Dexamethasone is given as oral more than IV more than IM. Oxygen is given if hypoxemic, that is if SpO2 saturation is less than 92%, oxygen is given in laryngotracheobronchitis case. Next is parvovirus B19 infection. It is a viral infection. It mimics erythroblastosis fetalis in early pregnancy. Others include pure red cell aplasia, transient aplastic crisis as well as erythema infectiosum 5th disease. Cowdry type A inclusion is seen in herpes simplex infection vesicles. It is a light purple homogeneous intranuclear structure surrounded by clear halo. 11-year-old boy presented with multiple abscesses on face, back and chest. History of recurrent respiratory infections are present. Atopic excoriating skin, multiple cold abscesses on his back. Diagnosis is hyper IgE syndrome. It is also known as Jobs syndrome. It is autosomal dominant condition. It is a primary immunodeficiency disease. There is mutation of STAT3 gene. MHC class 2, there is a peptide antigen to CD4 T cells. Action of MHC2 occurs via endocytic pathway. MHC2 helps in the production on antigen presenting cell. MHC class 1 has endogenous peptide or endogenous antigen. There is CD8 T cells. It is cytosolic. Antigen binding site is seen between alpha 1 or alpha 2 groove. Nucleated cells and platelets are present in MHC class 1. Except sperm, other cells are nucleated. MHC class 2, it is exogenous antigen, CD4 T cells. MHC class 2 is an endocytic pathway. It is present between alpha 1 beta 1 group. Antigen presenting cells, which include macrophages, B lymphocyte and dendritic cells, are present in MHC class 2. Next is hemagglutination test does not use antibody marking. It is present in ABO blood typing. Hemagglutination inhibition reaction helps in the diagnosis of influenza. Next is Robert Koch is the father of bacteriology. He identified TB as well as cholera and also Bacillus anthrax. Next case is 3-year-old patient with history of cyanopulmonary infections which is caused by encapsulated organism which is due to the deficiency of IgG2. Deficiency of IgG1 causes bacterial infections like diphtheria, tetanus. Deficiency of IgG3 causes viral infection. Deficiency of IgG4 causes parasitic infection. Antibody maximum across placenta is IgG1. Least transplacental movement is by IgG2. Kirby-Bohr method is disk diffusion method for antibiotic susceptibility testing. Other method is Stokes disk diffusion method. Next case is a patient who is a veterinarian had a ulcer with black eschar in the forearm. Most causative organism is Bacillus anthracis. Cutaneous anthrax or Hyde-Potter's disease which causes malignant pustule. Other anthrax disease is Wool-Sorter's disease which causes hemorrhagic pneumonia. Intestinal anthrax causes hemorrhagic diarrhea. Immediate test and screening UTI include wet mount examination, leukocyte esterase test, grease nitrite test which is known as nitrate reduction test, and also catalase test. Quantitative culture includes pour plate method as well as standardized loop technique. Dilution method includes broth dilution method as well as agar dilution method. Combination of diffusion as well as dilution method includes E-test, that is epsilometer. 18-year-old female patient has severe headache and also high fever of about 101 degree Fahrenheit. Papilledema, nuchal rigidity was present. Gram staining of CSF showed Neisseria meningitidis. The bacteria is intracellular gram-negative diplococci. Investigation of neurosyphilis is VDRL test. CSF VDRL is highly specific. CNS syphilis is detected by examination of CSF for mononuclear pleocytosis, that is more than 5 WBC per milliliter, increased protein concentration more than 45 mg per deciliter, and CSF VDRL reactivity. Streptococcus pneumoniae is gram-positive capsulated flame-shaped or lanceolate-shaped diplococci. Listeria monocytogenes is a gram-positive bacillus. Cryptococcus we give mucicarmin. Contact-based isolation is for MRSA as well as open wounds. Droplet-based isolation is for mumps and diphtheria. Airborne precautions are taken for SARS, varicella, Mycobacterium tuberculosis as well as measles. Whipple's disease, renal cell carcinoma and Ewing sarcoma we use PAS. Marfan syndrome, emphysema lung, malignant hypertension we use Verhoef's method. Fatty liver, fat embolism, fibroma, thecoma ovary, liposarcoma. For all this we use oil red O Sudan, black Sudan 3 or 4. Barrett's esophagus we use Alcian blue. Early cirrhosis of liver as well as myelofibrosis we use reticulin stain. Gomori methanamine silver is used for fungi. H. pylori spirochetes we use Warthin starry staining. Toluidine blue is used for mast cells. Bird to anthropod, anthropod to human. This transmission route is seen in Japanese encephalitis. Rubella belongs to Toga virus family. In 2020, it is said that rubella belongs to Matona family. A 23-year-old patient who traveled to China had pickled crab, complaints of rusty sputum as well as cough. Paragonimus westermanni, which is a trematode containing metacercaria, is affected by him. Drug of choice for the above is praziquantel 25 ml per kg 111 into 1 to 2 days. 30-year-old female patient with pruritic papules Excoriated plaques, interdigital web spaces, later spread to groin and undersurface of breast. History of intense pruritus is severe at night. This case is scabies. It is caused by itch mite, which is also known as Sarcoptes scabi. Female parasite lay egg in burrow. It burrows into stratum corneum. There are 4 stages of this egg. First is egg, then to larva, then nymph, and later adult. This adult stage of egg forms 1 to 2 months live. Treatment is permethrin cream 5%. Next is patient complaints of seizures. MRI brain was taken which showed scolex with multiple cystic lesion. Neurocysticercosis was diagnosed, which is caused by larval form of Tinea solium known as cysticercosis cellulose. Drug of choice include glucocorticoid therapy as well as albendazole. A vaccine strain change due to evolving organism is influenza vaccine. It is a periodic strain change due to antigenic change in surface glycoprotein of virus. Gradual change is known as antigenic drift. Drastic change is antigenic shift. Clinical features of neurocysticercosis include epilepsy, increased ICT, hydrocephalus, mental disturbances, meningoencephalitis, transient paresis, behavioral disease, aphasia, visual disturbances. CT and MRI of neurocysticercosis include scolex within a cyst, cystic lesions with or without ring enhancement, nodular calcifications, focal enhancing lesions, multilobulated cystic lesions on subarachnoid space. 70% of the adult onset epilepsy is seen here. Next is Cyclospora causes unsporulated cyst, Isospora causes unsporulated cyst. HIV causes persistent diarrhea. A patient had coccidian parasitic infection. Kinyon stain was done which showed positive oocyst. Diagnosis is Cryptosporidium infection. Diagnostic form of Cryptosporidium is sporulated cyst. Oocyst is round shaped which contains 4 sporozoids which is uniformly acid fast on staining. Treatment of Cryptosporidium infection is by fluid replacement as well as cotrimoxazole.